Beyond the brain. How 16 common health conditions impact dementia risk, a groundbreaking large-scale analysis, has revealed a profound connection between systemic physical health and cognitive decline. Researchers have identified that approximately one-third of all dementia cases, globally representing roughly 18.8 million people, may be statistically linked to health conditions affecting parts of the body entirely outside the brain. The scope of the connection traditionally, dementia prevention has focused on brain-specific concerns and lifestyle habits like diet, exercise, and sleep. While these remain vital, a recent systematic review and meta-analysis conducted by researchers at Sun Yat-sen University suggests that the dementia burden is much more widely distributed across various bodily systems than previously understood. By analyzing data from over 200 studies, including the Global Burden of Disease Study and the UK Biobank, researchers examined 26 different peripheral diseases, conditions affecting organs or systems other than the brain. Their goal was to determine the population attributable fraction, a metric that calculates what percentage of dementia cases could potentially be linked to specific, non-neurological conditions, the leading contributors to cognitive risk. The study identified 16 specific conditions that contribute to the global dementia burden. The findings highlight that many of these risks stem from common, often manageable, ailments. Periodontal disease, gum disease, linked to approximately 6% of dementia cases. Chronic liver disease accounts for roughly 5.5%. Hearing loss contributes nearly 5%. Vision loss associated with about 4%. Type 2 diabetes accounts for roughly 4%. The research also identified several other significant contributors, including chronic kidney disease, ischemic heart disease, and stroke, chronic obstructive pulmonary disease, COPD, and asthma, atrial fibrillation, inflammatory and autoimmune conditions such as rheumatoid arthritis, multiple sclerosis, eczema, and inflammatory bowel disease, osteoarthritis. Why this matters. The interconnected body. This research shifts the conversation from viewing dementia as an isolated, neurological event to seeing it as a consequence of systemic health. The link between these conditions and dementia often involves shared pathways, such as chronic inflammation, vascular health, and metabolic dysfunction. For example, gum disease and liver disease can trigger systemic inflammation, while hearing and vision loss can lead to cognitive strain and social isolation, both of which are known risk factors for decline. The significance of these findings lies in the preventative potential. Unlike many neurological conditions that are difficult to detect early, many of the peripheral drivers, such as blood sugar levels, dental hygiene, hearing, and blood pressure, highly detectable and often treatable through routine medical care. Strategies for cognitive protection. While these findings show statistical associations rather than direct cause and effect, they offer a roadmap for proactive health management. Prioritize oral hygiene. Regular dental cleanings may protect more than just your teeth. They may mitigate systemic inflammation. Address sensory health. Early screening for hearing and vision loss can reduce the cognitive load on the brain. Manage metabolic and cardiovascular health. Controlling blood sugar and maintaining healthy blood flow supports both the heart and the brain. Monitor chronic inflammation. Managing respiratory, autoimmune, and inflammatory diseases is essential for reducing long-term neurological stress. Conclusion. The human body functions as an integrated system where the health of the liver, kidneys, gums, and sensory organs directly influences brain longevity. Recognizing these connections suggests that managing common physical ailments may be a powerful, often overlooked tool in dementia prevention.